Hi there, I'm Dr. Shika Chabra, one of the GPs at Verve Family Doctors. This is a quick message to let you know some important information about our Pfizer COVID-19 vaccine clinic for children aged 5 to 11 years old. Firstly, thank you for choosing to have your child vaccinated. After their 2 doses, they will be 91% less likely to get sick from COVID-19, and they'll be helping to protect themselves and people around them from COVID-19. Children aged 5 to 11 years old require 2 doses to be given, 8 weeks apart as per current guidelines. The first dose, which will start to take effect from about 2 to 3 weeks after the first dose, but it's often only a short-lived immunity, which is why the second dose is so important. Our clinics are run very efficiently because we're trying to vaccinate as many children as we can as soon as possible. If you have any questions about the vaccine or are unsure if you want to proceed, please do not book directly into the clinic, but instead book in a consult with your GP so we have time to discuss your concerns. If you haven't already, please make sure that you've also booked in for their second dose at the 8-week mark as soon as you book in the first dose. You should receive a link for an online consent form. Please complete this prior to your appointment if you have not already done so at the time of booking your appointments. When you come into the clinic, you will have a very specific time allocated. Please arrive 5 minutes early to ensure there's time to park and get here, but wait outside the clinic until your allocated appointment time so we avoid overcrowding. Please have your child wear short sleeves and have their left arm ready to go when you arrive. If you would like the vaccine to be given in your child's right arm instead, please let us know. The children's vaccine contains 1/3 the dose of an adult vaccine. It does not matter if your child is close to adult weight or size, as this dosage is actually determined by differences in the way that children mount an immune response compared to adults, regardless of their size. If your child has their 12th birthday between the first and second dose, they should have the children's dose for their first vaccine and the adult dose for their second dose. If your child has already had COVID-19 infection, they can safely receive their COVID-19 vaccination as soon as they've recovered from their illness and are out of isolation. However, there is some evidence that they may have natural immunity for at least 6 months after infection, so you can choose to delay it for up to 6 months. You can have the COVID-19 vaccine at any time before or after other routine childhood vaccinations. But if your child has had another vaccine in the past 7 days, please let us know at the time of the consult so we can discuss how best to monitor side effects. Expected side effects after the vaccine are less frequent in children compared with adolescents and adults, which is great news. Common side effects after the vaccine for children include pain, redness or swelling at the injection site, tiredness, headaches, and fevers and chills. Less common side effects include joint pains, muscle pains, and vomiting. All of these should go away within a couple of days. Your child can be given paracetamol or ibuprofen for symptom relief, and a cold compress on the arm may also help. The rare side effects of mRNA vaccines like Moderna and Pfizer can be severe allergic reactions known as anaphylaxis, and this is part of why we will monitor them for 15 minutes after the vaccine is administered. Rarely, there has also been cases of inflammation of the heart, myocarditis and pericarditis. The majority of these cases have been mild and resolved quickly. You should seek medical review if you think your child might be having a severe allergic reaction after getting home with difficulty breathing, wheezing, collapse. Make sure you call 000 if any of these things happen. And if your child reports having had chest pain, pressure, discomfort, an irregular heartbeat, any fainting, shortness of breath, or pain with breathing, all those things also warrant relatively quick, urgent medical review. Please remember that the COVID vaccine cannot give your child any respiratory symptoms. So if they do develop a runny nose, sore throat, a nasal congestion, anything like that, then please make sure you go and get them COVID tested as per usual. We look forward to seeing you here at the clinic soon.